Welcome to Training Module 2. During this brief training, you will learn how to administer a screening tool that targets intimate partner violence-related traumatic brain injury. You will be educated on the parameters of the screener, why each question is important, and be given real-life examples of how someone with a traumatic brain injury related to intimate partner violence might respond. So what is intimate partner violence? Intimate partner violence, often called IPV, can be defined as physical, verbal, or psychological aggression or abuse between couples in dating or marital relationships. Common synonyms for IPV are domestic violence, domestic abuse, domestic assault, and spousal abuse. IPV and traumatic brain injury. It is important to be aware of the relationship between traumatic brain injury and IPV because individuals who experience this type of abuse are vulnerable to brain injury. When professionals are aware and educated on intimate partner violence-related traumatic brain injury, they are able to identify common signs and symptoms that someone with a brain injury might possess. With this education, professionals are able to properly refer individuals to appropriate services that are specific for each case. So what can we do to help? A screening tool for intimate partner violence-related traumatic brain injury is available in order to screen individuals seeking help in domestic violence shelters. The screener is called the Greensboro Screening Tool for Intimate Partner Violence-Related Traumatic Brain Injury. The screening tool is comprised of 6 questions, which expands on brain injury symptoms, the number of occurrences, and if any medical attention was sought out after the event. In the following slides, each question of the screener will be reviewed in order to provide experience with the screening tool, how to fill out the screening tool, as well as why each question is important to ask. Pre-screening information. When asking these questions on the screener, try to ensure the victim is away from others involved in the situation and feels safe. This is very important due to the intimate information being discussed. The more the individual feels safe, the more likely they are to give pertinent details that are crucial for the screening. After you have transitioned to a safe location, you, the professional, will give the verbal prompt of, I am going to ask you a series of questions about possible injuries to your head, face, and/or neck. Begin by asking the individual question number 1, which states, did any of the following happen to you? Were you hit on the head, thrown against something where you banged your head, shaken violently, choked, or smothered? With answer choices, yes, no, and maybe/not sure. Once the question is read, the administrator will circle the appropriate answer. Then the professional will prompt the individual to provide further information if they answer yes. So why is this question important? As you have learned in Module 1, if an individual has any type of trauma to the head, a traumatic brain injury is possible. If the individual is choked or smothered, a loss of oxygen to the brain may occur, which can result in a traumatic brain injury. Often, people do not associate being choked or smothered with sustaining a traumatic brain injury, but we must remember that the brain requires oxygen to carry out functions within. When the oxygen source is cut off, changes in the brain will result. Following the above question, the administrator must ask, did this event occur in the past few hours? With answer choices, yes or no. If the individual answers yes, circle yes from the options given. So why is this question important? If the individual answered yes, we as the professionals know the injury is acute or sudden or rapid onset, and the damage has just occurred. The brain has not had time to heal, and the signs and symptoms that are present now might be different than an injury that happened days or even weeks prior. If the individual answers no, this injury can be classified as non-acute, or not sudden, or a greater amount of time has passed since the event of injury. It is important for the professional to be aware of what signs and symptoms are continuing to persist after time has passed. If the individual answers yes, the administrator will also prompt by asking, where and when did it occur? Then the professional will write down the place and the time that a possible injury occurred. Now we will watch a reenactment of how this question might go in real life.
Hi, I'm going to ask you a series of questions about possible injuries to your head, face, and/or neck.
Okay, that's fine.
Did any of the following happen to you? Were you hit on the head or face, thrown against something where you banged your head, shaken violently, choked, or smothered?
I think so, but it all happened too fast.
I'm sorry to hear that. Can you explain a little more what happened?
Well, my head is a little sore over here, and I think I hit it on something really hard.
Did this event occur within the past few hours?
It happened this morning, and then I came here just to get away for a bit.
Okay, thank you so much for sharing this information with me. I have a couple more questions for you.
Okay. After question 1 is complete, you will move to question 2 and ask, during or immediately after this event, did you lose consciousness or pass out? Or was there any period of time after this event that you aren't able to remember? With answer choices, yes, no, and maybe/not sure. Once the question is read, the administrator will circle the appropriate answer. Then the professional will prompt the individual to provide further information if they answer yes. So why is this question important? If an individual answers yes to losing consciousness or passing out, the brain is without oxygen. As we know, when your brain doesn't receive oxygen, different areas of the brain are affected and can sustain damage. If they answer no to this question, it is still important information. Injuries to the head or face have the ability to result in loss of consciousness and passing out. The individual might not remember the event and severity of the impact. Now we will watch a quick reenactment of how this question may go in real life.
During or immediately after this event, did you lose consciousness or pass out? Or was there any period of time after the event that you aren't able to remember?
No, but then again, it happened so fast I'm not 100% sure.
Alright, sometimes these things happen so fast it's hard to remember. Thank you for answering this question.
You're welcome. After you ask questions 1 and 2, you will move to question 3, which states, after the event, did you experience a period of feeling confused, dazed, or lightheaded? Yes, no, and maybe/not sure. Once the question is read, the administrator will circle the appropriate answer. Then the professional will prompt the individual to provide further information if they answer yes. So why is this question important? Feeling confused, dazed, or lightheaded may be a sign of brain trauma due to a head injury. Now we will watch a reenactment of how this question might go in real life.
After the event, did you experience a period of feeling confused, dazed, or lightheaded?
You could say that. I just felt a little off after the incident.
Okay, can you explain a little more about how you felt after the event occurred?
Yeah, I don't think my thinking was as sharp as it usually is. I felt a little bit confused, and my head was really hurting, so I felt a little lightheaded.
Okay, thank you for answering that. We will now move on to the next question.
Okay. The examiner will then ask question 4. Are you now or did you then experience any of the following symptoms? The examiner should read each of these symptoms aloud to the individual. These symptoms include nausea, excessive fatigue, depression, etc. And why is this question important? If an individual is experiencing these symptoms, it implies that something in the brain is not working properly. If the individual seeks medical attention, this information could help them determine what area of the brain may be affected. We will now watch a clip of how this question may look in real life.
Experience any of the following symptoms? Nausea?
No.
Vomiting?
No.
Sensitivity to light or noise?
No.
Headaches?
Yeah, I had the headache on my left side.
Okay, can you explain a little bit more?
It just hurts there because I think I fell and hit there.
Okay. Ringing in your ears?
No.
Dizziness?
Yeah, I have a little bit of dizziness. Okay. Just when I stand up from a sitting position.
Okay. Can you explain a little more?
So I just feel a little woozy, kind of off balance.
Yeah. Excessive fatigue?
No.
Blurred vision or double vision?
No.
Difficulty balancing?
Yeah, I would say this goes along with the dizziness.
Problems sleeping?
No.
Problems moving your arms and legs?
No.
Anxiety or excessive worry?
Well, I worry about what's going to happen when I go home.
Can you explain a little bit more?
Well, I'm just really tired of all this happening, and I fight with my husband a lot.
I'm sorry to hear that. Do you experience any depression?
No.
Irritability?
No.
Problems concentrating?
No.
Difficulty talking?
No.
Difficulty remembering new information?
No.
Problems organizing thoughts?
Yeah, you could say that a little bit. Sometimes I feel like it takes me a couple seconds to think about what somebody says to me or what I want to say to other people.
Okay. And let's see. What about organizing daily activities?
No.
Okay. Difficulty following through on daily tasks?
No.
And difficulty following conversation?
No.
Okay. Thank you for answering these questions. We have a couple more left.
Okay.
After you ask question number 4, you will move to question number 5. If the individual's event was in the past, you will ask, did you see a doctor following this event? If the individual's event was recent, you will ask, do you plan to follow up with a doctor? Once the appropriate question is read, the administrator will circle the corresponding answer. So why is this question important? If the individual attained medical care, we may find out information on whether they were screened for a TBI or if TBI education was provided. If the brain injury was recent and they do not plan on seeking medical attention, then the staff will know that the individual may not be aware of the extent of the injury. Staff will also have the opportunity to provide educational information about traumatic brain injuries. We will now watch a reenactment of what this question may look like in real life.
Do you plan to follow up with a doctor?
No, I hadn't planned on it.
Okay. So sometimes when injuries to the head occur, you might not feel injured due to the damage not being visible, but inside the body there can be internal damage, damage to the brain that you might not see. So it is important to follow up with a doctor if that's something you are considering or it might be of importance.
Okay, thanks.
The last question of the screener is question 6, which states, has anything like this happened to you before? With yes, no, and undecided maybe being answered. Once the question is read, the administrator will circle the appropriate answer. If yes, ask the individual to provide a summary and estimated number of occurrences. So why is this important? It is important to know the number of times a blow to the head has occurred due to the fact that the more times an individual has sustained injuries to their head, the more severe the TBI may be. We will now watch a reenactment of what this question may look like in real life.
Has anything like this happened to you before?
Yes.
Okay. Can you tell me a little more or how many times it's happened?
So my husband and I fight a lot at our home. It could be over silly things, but sometimes he pushes me and then I fall onto things, like when I fell on and hit my head this past time. I think it's happened at least 5 times this year so far.
Okay. Thank you for answering this question and all of my questions. We've now completed the screener.
After the screener is completed, follow-up actions may be taken. There could be no follow-up. You could speak to the victim about risk of brain injury. You could have advised the victim to seek medical attention, have the victim transferred to the emergency room, or explain to a friend, neighbor, family member the risk of brain injury. You have now completed Module 2. This module explains step-by-step how to go through, fill out, and administer the Greensboro Screening Tool for Intimate Partner Violence-related traumatic brain injury. This tool is great for asking specific questions that target injuries to the head, neck, or face, symptoms following, and what steps were taken by the individual after the event occurred.